Thank you. So good afternoon, everyone. It's my great pleasure to be here and to be able to discuss about the development and diabetes. And this is thank you for the committee that inviting me here with a wonderful symposium. So when we talk about the adolescents, we will have many programs related with not only about the health, but also the psychological problem. So in this talk, I will discuss about the developmental challenges in adolescents, dealing with diabetes at school, diabetes and exercise, alcohol, smoking, drugs, and other problems in adolescents. So as in 2014, an estimated 387 million people have diabetes worldwide, of which type 1 diabetes account between 5 to 10%. And in the United States, only 70% of early young adults with type 1 diabetes meet current recommendation for glycemic control, which is with A1C level less than 7. And they also found that 50% of young adults with type 1 diabetes develop diabetes-related complications in their 20s, including nephropathy, retinopathy, and also the hypertension. So as we know that the adolescent is the transition period between the childhood and emerging adulthood. And in this phase, we will have a growth and maturation process. So adolescent will have a different physical growth, maturation of organ system. There is increase in understanding and intellectual maturity of adolescents. Also changes in puberty. This is very important because the changes in puberty means the changes in physical, sexual, also mental maturity. So this kind of changes in adolescent, they will have some developmental changes, including lifestyle consideration, also healthcare system challenges. For example, the transition from childhood to adult. There is some physiosocial concern, such as they have a problem with the identity, they have a problem with stress, depression, and sometimes they will take the risky behavior. And also there is an important thing in this period. This is a supportive network from the parent, from peer, or from others. So International Society for Pediatric Adolescent Diabetes, in their guideline in 2018, they put the emerging needs of adolescents due to developing independence and lifestyle changes. First of all, adolescents have an overriding importance of belonging to and fitting into the peer group's social norm and behavior. So peer group is very important in this situation. And they have experimentation and exploration of different lifestyle, which conform less acceptability with family expectation and routine. There is also increasing independence from parental care. There are sense of instability and not yet developed cognitive skill to fully understand the consequence of today's behavior on future outcomes. There are also expectations for privacy, confidentiality, right to consent or to deny the medical treatment. They also have a problem with the pressure of academic achievement and competition. They start to entry into the workforce. They also have a risk to exposure to smoking, alcohol, and drugs. And there is a variability of sleep patterns with lack of regular routine in day-to-day activities. And there is also different level of physical activity. So sometimes adolescent will increase in sporting activity, but many others, and I think right now there are many adolescents with the lower physical activity, with greater time spent on the computer screen or the internet and television, there is a screen time more than other, and also difficult in following advice and responding to conventional health education. So we need the care strategies in the adolescents management. First is the diabetes care team versus adolescent. So the adolescent and the diabetes care need to develop trusting relationship. And also we have to help adolescents to clarify the priorities and give well-directed education about the puberty, because there is some changes in puberty. Also, there is we need a regular screening for complication. And the other is care strategies between parent and adolescents. Of course, we need the new parental involvement level. We need the gradual transition of responsibility. And we have to consider about how the parenting style related to outcome, because some parents probably have a different parenting style. There is a permissive or probably democratic. And in this time, we need the participating in making decision. So not only the parent, but also the children. And one of the study in United States, this is a qualitative study among type 1 diabetes adolescents. They mentioned that they need a social media. So there are some demand and also acceptability, including improved communication outside of clinic, independence in diabetes self-management, delivery of timely and personalized care, and connection with other youth with diabetes. And they want to have an implementation and practically in management of diabetes, including ensure the patient safety and privacy, and maintain professional nature of provider-patient relationship. Also they recognize that the social media is not currently used for medical care. So they encourage the use social media to support type 1 diabetes management in adolescents. And there is some problem related with the diabetes in adolescents, including how to do exercise, how to deal with puberty, dealing with diabetes at school, how about the alcohol and drug, sexual health, and the most common problem in adolescents is sub-metabolic control. And the most common problem is about the insulin and puberty, because during puberty, there is an increase of growth hormone, and also the testosterone or estradiol can cause physiological insulin resistance. So usually we will increase 1.5 times or twice the dose than before or after puberty. And in this puberty, sometimes we found that there is a varying level of physical activity on different days. So we need to adjust the insulin requirement to decrease the risk of hypoglycemia. And also the girls that have already menstrual period, they need, maybe they need adjustment of insulin because there is a fluctuating insulin sensitivity. So the problem in adolescents, there is a risk of deterioration in metabolic control. So endocrine change leading to increased insulin resistance. There is a problem with the erratic meal and exercise pattern, the poor adherence to treatment regimens. There is some eating disorder among adolescents, and hazardous and risk-taking behavior among adolescents. And there are some also clinical causes of uncontrolled diabetes in adolescents. The most common cause is concurrent infection, and also inadequate routine monitoring, because they want to be not controlled by the parents, so sometimes even the routine monitoring is even difficult. And there is a surgery or severe trauma. Cortisone-like medication, for example, adolescent with asthma. And there is lipohypertrophy, failure to increase insulin for growth spurt. There is also major emotional problem. There is a hypoglycemia fears among adolescents, also alcohol, drug, and pregnancy. So one of the important in adolescent is about the severe hypoglycemia. We have a specific concern for this during adolescence because sometimes the fears about hypoglycemia may be associated with poor metabolic control in adolescents. And sometimes they develop hypoglycemic unawareness. And also, sometimes we have a confusion with alcohol intoxication, confusion with recreational drug effects, or there is a alter in sleep pattern, and the effect of hypoglycemia on driving. We have to consider about that, and the effect of hypoglycemia on academic, sports, or work performance. And how about the dealing with diabetes at school? So all children, all adolescents have the rights to be admitted to school, to receive appropriate care for diabetes while in school, to be fully integrated into school environment by ensuring their safety. And so this is the responsibility of the parent and also diabetes team to educate the teachers and others at school, for example, about the insulin, meals, blood tests, and acute complication, particularly hypoglycemia. And also supporting the school and teacher to care for the child with that diabetes. And can the adolescent with the diabetes doing exercise? We have to aware that exercise and diabetes related to the hypoglycemia, but also hyperglycemia. This some factors that involved in this, about the duration of the physical activity, intensity of activity. For example, for an aerobic sport, maybe they will have, in the beginning, they will have a hyperglycemia due to the cortisol and adrenaline increasing. Also the type of activity, of the physical activity, type and timing of food. So usually we give a snack before they go to the exercise. Also the absorption of insulin, metabolic control of the patient, time and timing of insulin injection, and also the degree of stress or competition. So in adolescent, we have to manage the exercise and the activity. So first is check the blood glucose level before participating in the exercise or physical activity. We give snack before activities or mid or after activity. We need to monitor blood glucose level 30 minutes to 60 minutes after activity. And a low glucose level should be treated with additional rapidly digested food like juice or table sugar. And after prolonged activity, additional snack before sleeping or blood glucose monitoring during the night is very important because sometimes they will have a delay hypoglycemia. And the other in the adolescent, we concern about the alcohol, smoking, and drugs. Because this is a serious concern during high school, usually, particularly in the chronic condition. And in US, youth with type 1 diabetes self-report, they found that they use alcohol vary from 10 to 90%. But the recreational drug and smoking are less common than healthy peers. So according to this problem, we need to encourage the adolescent to avoid smoking, drug, and adolescent. But we need a realistic advisory approach because sometimes the adolescent, they will have difficulties to receive the advice from us. And the information about the effect of the alcohol, we need to give them. Also aware that hypoglycemia may occur when drinking alcohol without eating. And we need to avoid nocturnal hypoglycemia. The adolescent need to ingest carbohydrate while drinking, and they need a good hydration. And please measure the blood glucose before bedtime, and also having carbohydrate before sleep. And how about if adolescent want to have a driving? Because a person with diabetes is eligible to hold a driving license. So we need to prevent the hypoglycemia while driving by blood glucose monitoring. So before starting to drive, and also make an appropriate food intake. So we also encourage the stable metabolic control in individual with diabetes, and also need the regular check-up of the visual health. In adolescent, this is maybe they have a variety in the different countries, but the education should begin during early puberty. And we have to, this is according to ISPAT guideline, we need a non-judgmental approach to sexual activity in adolescents. We also can give them advice on method of avoiding pregnancy and sexually transmitted infection. And we need also to prevent the hypoglycemia during or after intercourse. And we advise on genital hygiene, vulvovaginal candidiasis, sexual transmitted infection, and also about the menstrual disorder. And right now, the most important is the transition from pediatric to adult services. So actually the transition care is a plan, a movement of adolescent with the chronic disease from child and family center to an adult-oriented health care system. We need a good preparation and adaptation for this, and we need a multidisciplinary diabetes services. We have to understand about the two different system care, because there is very big difference between pediatric care and also adult care. So we have to discuss with the patient and the family what is the best time to transfer. So this is our summary. So adolescence is the transitional phase between childhood and emerging adulthood. It is essential to identify the psychological problem among adolescents with diabetes. Education and healthcare strategies is needed to achieve optimal metabolic control, and we need the transition program from adolescent to adult. Thank you, and thank you very much for your kind attention.